This is a rapid test. This is an optigene test, which works on replicating the RNA of the virus. Anybody who tests positive will be called, and they will be informed of this, and then they will be required, and this is a legal requirement, to isolate together with members of their family. So anybody who lives in the household would have to isolate for a period of 10 days.
So we're going to have to assess what the chances are of a person having the virus, and the best way to assess that is how many other people are they in contact with as part of their normal duties and their normal day-to-day work. There are lots of other people saying, I'm a frontline worker. We will need to just assess how often they meet other people and then grade it according to that particular risk pattern.
So we're using a technique called RT-LAMP. It's reverse transcription, loop-mediated isothermal amplification. So basically, in simple terms, what that means is it allows us to take a patient swab with viral RNA, turn it into DNA because it's more stable, and then we can amplify it into lots and lots of copies, label it with something fluorescent, and then detect that.
We'll be processing the samples in the biological safety cabinet there and preparing reagents in the adjacent lab room. Then we will mix the reagents with the samples, and after disinfecting everything, we will pass on to the analysis room, where we are equipped with 5 Genie machines that will detect the fluorescence, which indicates the presence of a virus. So then after we have the results, which are produced within about 2 hours of starting the sample extraction, we can pass on the information back to the contract tracing team, and that will inform the people who have had the swabs taken about whether they are positive or negative for the virus.
We have a team partly based at the field hospital and partly the 111 team, who will then set out to trace all the contacts that person has been with, so that they can also be advised, tested if necessary, can talk about symptoms, and possibly also for them, they may need to self-isolate.
There's no biological reason why we should exclude children, but clearly there's the complexity of parents having to give the consent and then being worried if the case is positive. So we haven't got any plans at the moment to do children, but potentially, and this is perhaps up to your viewers, would they want to know if their children have been infected or not? I mean, that's a rhetorical question. I don't want people to bombard me, but clearly there's a debate to be had.